Hi, I'm Dr. Elston, and today we're going to talk about when you will be seen after your surgery. After surgery, particularly lipedema surgery, we have a pretty standard schedule of when patients will come in for their post-op visits. If you're from out of town, we usually like to see you 3 or 4 days after your surgery before you head home. For some surgeries, like doing the arms, we only need to see you the next day. But at some point, you're probably going to be seen in the first week to make sure that you don't have a seroma, make sure there's no infection, and make sure your pain is well controlled. After that, we typically see patients about 6 weeks out from surgery, and that's really more of like a psychological check-in. Usually everyone is doing well in terms of how they're recovered, but they don't have the final results of their liposuction yet, and it can be a very frustrating time because you feel better mentally, but then your body hasn't quite caught up yet, and it can be very discouraging. I tell patients that they can expect to get a little bit bluesy, maybe a little bit depressed, and that's really why I want to see you at that 6 weeks, is to let you know this is not the full result. You're going to see benefits for 3, 6, 9 months afterwards, and just really just come back in. Don't be too nervous about it. It's going to get better. And then afterwards, we typically see patients about 3 months out from their surgery, unless they're doing a staged procedure where they're doing multiple surgeries in a row. And then we're typically talking about scheduling another procedure at that point. So you can expect to be seen sometime in the first week, probably around 4 to 6 weeks after surgery, and then at 3 months, and then whenever you need to be seen afterwards. If this is helpful, please consider sharing it with someone and please consider subscribing to our channel.